Let me ask you something, and I want you to answer this honestly, just between you and me. If you looked down one day and noticed that your urine had turned pink or red or a dark brownish color, what would you do? Would you call your doctor immediately? Or would you tell yourself it was probably nothing, wait a few days, and hope it went away on its own? If you're being honest, and most men are, when I ask them this in my office, the answer is usually the second one. Wait, watch, hope. And I understand that instinct completely. But here is what I need you to hear right now before we go any further. Blood in the urine is never something your body does by accident. It is always a signal. It is always your body communicating something specific. And what it's communicating, whether it turns out to be something simple or something serious, deserves a prompt, informed response. My name is Dr. Reena. I've spent 12 years in clinical practice working with men on some of the most important health questions they'll ever face. And today I want to have a calm, clear, genuinely useful conversation about what blood in the urine actually means, what causes it, what the body is trying to tell you, and exactly what to do when it happens. This is not a video designed to frighten you. It's designed to prepare you because the men who navigate this the best are always the ones who understood it first. Before we dive in, if this kind of honest, practical health content is valuable to you, please hit the like button right now and subscribe so you never miss a conversation like this one. And drop a comment below. Tell me, where in the world are you watching from today? I love connecting with this community from every corner of the globe. Now, let's talk about something most men never want to think about, but every man needs to understand. Here is the myth I want to address right at the start because it is responsible for a significant amount of preventable harm. The myth is this: if it went away on its own, it was probably nothing serious. When it comes to blood in the urine, that belief is medically dangerous. Here's why. Many of the conditions that cause blood in the urine, including some serious ones, are intermittent by nature. The bleeding comes, the bleeding stops, the urine returns to its normal color, and the man concludes that whatever it was has been resolved. But the underlying cause has not been resolved. It has simply stopped actively bleeding for the moment, and the window for early, straightforward intervention is quietly closing. Blood in the urine, whether you can see it with your own eyes or whether it was only found under a microscope during routine testing, always warrants a proper medical evaluation every single time, without exception. That is not an overreaction. That is simply the medically appropriate response to a signal your body is sending you. In 12 years of clinical practice, I have sat across from many men who came to me after weeks, sometimes months, of noticing something in their urine and telling themselves to wait and see. I think of a patient I'll call Dennis, 64 years old, retired, came in for a routine visit and mentioned almost as an afterthought at the end of the appointment that he'd noticed some pinkish discoloration in his urine a few weeks back. It had only happened twice. It had gone away on its own. He almost didn't mention it. We investigated. We found something caught early enough to treat effectively with excellent outcomes. Dennis told me afterward, I almost didn't say anything. I thought it would sound like I was overreacting. He was not overreacting. He was, in fact, the reason early detection saves lives. Today, I want to make sure you understand what your body is communicating so that you never stay silent when it matters most. Let me walk you through the main reasons blood appears in the urine. Understanding these not only removes the fear of the unknown, it gives you the language to have an informed conversation with your doctor. Because number one, kidney filter inflammation, glomerulonephritis. Your kidneys contain roughly 1 million tiny filters called glomuli, microscopic structures. So precise that they allow water and waste to pass through while keeping red blood cells and proteins safely inside the bloodstream. When these filters become inflamed, a condition called glomerulonephritis, small holes develop in the filter membrane, allowing red blood cells to leak through into the urine. This is what we call a renal cause of blood in the urine, meaning the source is within the kidney itself. Biologically, this inflammation can be triggered by certain infections, by autoimmune activity where the body mistakenly attacks its own tissue, by certain medications, or by conditions that affect the small blood vessels throughout the body. Emotionally, because there is often no pain associated with this type of bleeding, men have no clear alarm signal telling them something is wrong inside the kidney. Practically, the blood found in this case is often microscopic, meaning you may never see it yourself. It shows up only when a doctor examines a urine sample under a microscope during routine testing. This is one of the strongest arguments for regular checkups, even when you feel completely fine. Cause number 2, kidney masses or tumors. I want to address this one carefully, not to alarm you, but because it's one of the most important causes to understand. Tumors within the kidney develop their own network of blood vessels. These vessels are abnormal, fragile, poorly formed, prone to spontaneous bleeding. When they bleed into the urinary tract, blood appears in the urine. Biologically, this is the body's own vascular system being disrupted by abnormal tissue growth. The bleeding can be significant and visible, or it can be minimal and intermittent. Emotionally, the word tumor is frightening, and I understand that. But here's what I need you to hold on to. Kidney masses detected early before symptoms become severe or the condition advances carry dramatically better treatment outcomes than those found late. Practically, if blood in the urine is accompanied by a dull, persistent ache in the side or lower back or unexplained fatigue or weight loss, this combination of symptoms warrants urgent evaluation. Do not wait. Cause number 3, kidney stones. This is the cause most men are at least somewhat familiar with, and for good reason. Kidney stones are one of the most common benign causes of blood in the urine, particularly in men over 50. Stones form when certain minerals and salts in the urine crystallize and clump together inside the kidney. They can remain there painlessly for extended periods, or they can begin moving through the urinary tract. As they travel, their sharp, irregular edges scrape and scratch the delicate lining of the tubes they pass through, causing bleeding. Biologically, the lining of the urinary tract, the ureothelium, is designed to be smooth and watertight. Any disruption to that lining, including the abrasion caused by a moving stone, triggers bleeding as the tissue responds to injury. Emotionally, kidney stone pain, when it occurs, is among the most severe pain a person can experience, and it tends to demand attention on its own. But smaller stones can cause bleeding with minimal or no pain, which is why they can go undetected. Practically, if you've had kidney stones before, or if blood in your urine is accompanied by pain in your side, back, or lower abdomen, a stone should be high on the list of possibilities your doctor investigates. Because number 4, bladder cancer. I'm going to speak plainly here because this is a topic that requires plain speaking. Bladder cancer is one of the most common cancers in men, and the most frequent and often the earliest sign is blood in the urine. The ureothelium, the specialized lining that runs throughout the urinary tract, including the bladder, can develop cancerous changes that produce abnormal, fragile blood vessels prone to bleeding. Biologically, this bleeding can appear suddenly, be quite visible, and then stop entirely, giving the false impression that the problem has been resolved. That pattern, visible blood that comes and goes, is actually one of the hallmark presentations of bladder cancer and should never be attributed to something benign without proper investigation. Emotionally, I know that hearing the word cancer in the same sentence as a symptom you've been experiencing is alarming, but I also know from 12 years of sitting with patients through these conversations that early stage bladder cancer is one of the most treatable cancers in medicine. The key word is early, and early only happens if you get evaluated when the symptom first appears. Practically any man who notices blood in his urine, particularly if it is visible and painless, needs to be seen by a urologist. Painless visible blood in the urine is considered a red flag symptom until proven otherwise. Cause number 5, urinary tract infections. Infections anywhere along the urinary tract from the urethra at the bottom all the way up to the kidney at the top can cause blood in the urine. As bacteria invade the tissue lining of the urinary tract, the body mounts an inflammatory response that can damage small blood vessels in the lining, resulting in bleeding. Biologically, the bacterial invasion triggers an immune response. White blood cells rush to the site, inflammation occurs, and the integrity of the urothelium is temporarily compromised. Emotionally, urinary tract infections in men are often accompanied by other symptoms: burning during urination, increased urgency, pelvic discomfort that make the diagnosis more straightforward. but in some cases, blood appears with minimal other symptoms. Practically, if blood in the urine is accompanied by any sense of burning, pressure, or urinary urgency, infection should be evaluated promptly. Untreated urinary infections can ascend to the kidney and become significantly more serious. Cause number 6, inflammation of the bladder lining interstitial. Sciitis, not all bladder inflammation is caused by infection. Interstitial sciitis is a condition in which the immune system attacks the lining of the bladder wall, causing chronic inflammation, bladder discomfort, and in some cases bleeding. Biologically, this is an autoimmune type process in which the body's defense system mistakenly targets healthy tissue. The resulting inflammation disrupts the bladder lining, allowing blood to enter the urine. Emotionally, because this condition is chronic and can produce intermittent symptoms, men sometimes spend years managing the discomfort without ever receiving an accurate diagnosis. Practically, if you've been experiencing recurring urinary symptoms, pressure, frequency, discomfort, along with intermittent blood in the urine, and standard infection tests keep coming back negative, interstitial sciitis deserves consideration and specialist evaluation. Cause number 7, physical trauma and strenuous exercise. Here is one that surprises a lot of men, particularly those who are physically active. Significant physical trauma to the abdomen, side, or lower back, the kind that might occur in a fall, an accident, or an impact injury, can damage the kidney or other structures in the urinary tract, causing blood to appear in the urine. This is relatively straightforward to connect to the cause when the injury is obvious. But here's what's less widely known. Extremely vigorous prolonged exercise, particularly long-distance running, can also cause microscopic trauma within the urinary tract that results in small amounts of blood in the urine. This is sometimes called runner's hematuria. Biologically, the repetitive impact and the mechanical stress of sustained intense exercise can cause minor injuries to the bladder wall and surrounding structures. Emotionally fit, active men who notice blood after intense exercise often feel confused because their instinct is that exercise is supposed to be protecting their health. Practically, blood in the urine following intense exercise should still be evaluated, not dismissed, because it needs to be confirmed that exercise is indeed the cause and that nothing else is contributing. Here is what I want you to do clearly, practically, and starting today. First, if you see blood in your urine, or if blood was found in a urine test during routine screening, do not wait. Do not adopt a watch-and-see approach. Make an appointment with your doctor or a urologist within days, not weeks. Second, be prepared to describe what you noticed accurately. Was the blood visible to you, or was it found on a lab test? Was it present throughout urination or only at the beginning or end? Was there any pain, any other symptoms? These details matter enormously for guiding the investigation. Third, expect a thorough workup. The two main pillars of evaluating blood in the urine are imaging. Typically a CT scan to evaluate the kidneys and upper urinary tract, and a procedure called a cystoscopy, which allows a specialist to visually examine the inside of the bladder and urethra using a small camera. Both are important. Both are manageable. Fourth, do not let embarrassment delay you. I know this is a topic that feels private. I know it can feel awkward to describe what you've seen in the bathroom to another person, but your doctor has this conversation regularly, approaches it without judgment, and needs this information to help you. Your dignity is fully intact in that conversation. And fifth, get regular checkups, including urine testing, even when you feel fine. Microscopic blood in the urine, the kind you cannot see yourself, is often the earliest sign of conditions that can be very successfully treated if caught early. The only way to find it is to look for it. Before we close, I want to say something that I say to every man who comes to me with this concern, because I've watched what happens when men finally stop waiting and start acting. The fear of what something might mean is almost always worse than the reality of finding out. The moment you have information, real information, from a real evaluation, you have power. You have options. You have a path forward. The men who do best are not always the ones who have the easiest diagnosis. They're the ones who showed up, who said, I noticed something and I decided I was worth taking seriously. You are worth taking seriously. Your health is worth this conversation. Here is what 12 years of clinical medicine has taught me with absolute certainty. The body is not your enemy, it is your most loyal communication system. Every signal it sends, including this one, is an act of cooperation, not a cause for shame or panic. Blood in the urine is your body saying, pay attention here. And the most powerful thing you can do in response is exactly that. Pay attention, take action, get the evaluation, find out what's actually happening, because you are not at the mercy of your health. You are an active participant in it. And that participation, showing up, asking questions, refusing to look away is what makes all the difference. If this video gave you clarity today, if it moved you from uncertainty to understanding or from avoidance to action, please hit the like button. It costs nothing and it helps this message reach the men who need it most. Subscribe if you haven't already. Every week, I bring you honest, empowering clinical health content designed specifically for men who want to live fully, not just long. And leave a comment. Tell me what stood out to you today, or just say hello and tell me where you're watching from. I genuinely read everyone. I'm Dr. Reena. Take care of yourselves, gentlemen, because you are absolutely worth